Welcome to Coastal Women's Healthcare and your early OB discussion. My name is Lauren and I'm one of the nurses. Let me start off by telling you a little bit about our practice. We are a team of 8 OBGYN physicians, 1 clinical nurse midwife, and 2 nurse practitioners, one of which is a part of our OB care team. Of this OB care team, 7 of the OBGYN physicians rotate on an on-call basis at Maine Medical Center to perform deliveries. You will be seen on a monthly basis until you reach your 7th month. Appointments will then be twice monthly until you reach your 9th month. During your last month of pregnancy, we will see you on a weekly basis and begin performing pelvic exams. At your first visit with your provider, it will be discussed if you need additional appointments. We strongly suggest taking an over-the-counter or prescription prenatal vitamin with at least 400 micrograms of folic acid. Taking folic acid is one way you can help prevent genetic abnormalities. If you are of advanced maternal age, you are at higher risk for genetic abnormalities as well as gestational diabetes, preterm labor, preterm delivery, and pregnancy-induced hypertension. It is also recommended that you receive a flu vaccine as well as a vaccine for tetanus, diphtheria, and pertussis. These can be obtained at your primary care physician. Early screening for genetic abnormalities is optional. We offer a non-invasive sequential screen, which can aid in detecting if you are at high risk for having a baby with a genetic abnormality. This is a 2-part screen. Part 1 includes an ultrasound and a blood sample from you at approximately 12 weeks. Part 2 includes a second blood sample from you at approximately 16 weeks. The results will be determined following Part 2 of this screen. Please remember this is not a diagnostic test, but a screening tool that aids in detecting the possibility of a genetic abnormality. If there is a known genetic abnormality in you, your baby's father, or either of your families, or if you are of advanced maternal age, you may already be at a higher risk for having a baby with a genetic abnormality. There are diagnostic testing options available. These diagnostic tests are more invasive and do have associated risks, which include cramping, bleeding, infection, and possible miscarriage. One of these diagnostic tests is a chromosome analysis called an amniocentesis. This involves a sample of the amniotic fluid to be drawn and evaluated. This can only be done between 16 and 18 weeks. Another diagnostic test that results in a chromosome analysis is called chorionic villi sampling. This involves evaluation of a sample of cells from where the placenta attaches to the uterus. This can only be done between 10 and 12 weeks. Initial blood work will be done at your first visit. For a more detailed list of what to expect at each of your appointments, and additional information on genetic screening options, activity and nutrition, as well as frequently asked questions can be found under the OB Suite on our website. Also, please create your secure portal account so you can request appointments, receive normal results, complete forms, and pay your bill. Please remember we do not allow children under the age of 5 in our ultrasound rooms. Thank you for choosing Coastal Women's Healthcare to be a part of your OB care.